Hi, everyone. I'm Billy Nguyen. I'm one of the R2s in pediatric residency right now at UCSF. I graduated from UCLA School of Medicine, the David Geffen School of Medicine, back in 2020. I knew early on in college that I wanted to do something in medicine. And so I really wanted to do something in academia, specifically in neuro-oncology. And I knew that maybe being a doctor would be this bridge between helping patients and really advancing the field of science. And so I started med school at UCLA in 2016, graduated again, like we said, in 2020. And then down the line, I really want to do academic pediatrics, specifically in the field of neuro-oncology, so brain cancers for kids. And I see myself running clinical trials, doing a lot of clinical research, and helping to get different clinical aspects of medicine into like the science and bridging the two worlds between medicine and science. So medicine's pretty diverse in the sense of each year kind of comes with its own territory. So the first 2 years, we call them preclinical years. And that's usually when you're more like in the classroom, doing a lot of didactics, anatomy, physiology, and all that, what we think of as like schoolwork. And then third and fourth year is primarily clinical. So really in the hospital, getting hands-on with patient care, and kind of following almost like your own patients from rotation to rotation. And so in GIST, so by year, the first year is where you really learn like normal physiology. And a lot of that is like, what does a normal human body look like? So you're doing classes like physiology, histology, anatomy. The second year is focused more on pathology. So looking at what goes wrong in the human body. And again, the same like subsets, you do histology, anatomy, physiology. And then at the end of second year, everyone takes the step 1 exam, which is this huge exam that we all study for, and has a big deal with our future as clinicians. And then third year is primarily the clinical rotation year. So you rotate through different subspecialties. So fields like surgery, OB-GYN, pediatrics, neurology, internal medicine. You kind of get a flavor of each different specialty and see really where your people are and where you fall in the specialty. And then the last year, the fourth year, is a year for you really to delve into what you're applying into. So for me, I was really interested in pediatrics. So I did a lot of pediatric rotations just to explore the field deeper and to see if it really was the right choice for me. And by the end of third year, beginning of fourth year is when you start applying for residency. I think UCLA is a very interesting place to learn and train as a medical student. So the area is very diverse. You have a large patient population. So we work at what's called a tertiary center at Ronald Reagan Medical Center. That means like it's a huge referral hospital for a lot of other smaller community hospitals. But we also have community centers like at All of You. Cedars is another powerhouse tertiary center that we work at. And there's a really large plethora of patient cases that we see. And that really makes for an interesting like clinical year. In terms of like the preclinical years, I think we have outstanding faculty. Our anatomy head, Dr. Stark, is one of the best anatomy professors. And I still retain quite a bit of information from her anatomy sessions, even now as a second year in residency. So the advice that I got from one of my early mentors in college for people really interested in medicine is really crafting the why of medicine and crafting your story. And so what that meant for me was trying to figure out what my niche was and how the experience that I've done really impact my application, right? And so for anyone going into medicine, I really encourage you to find the why of medicine. Like, why are you doing these extracurricular activities? And like, what does it do for you? How do those experiences that you do, whether it be like volunteering, research, how do those contribute to your interest in medicine? And with those experiences, like, what can you pull away that will make you be a better doctor? And so I think that's my biggest advice, finding a story that you can craft and making the experiences tailored to that story. And that's probably the biggest thing I can pass on to undergraduates. The second thing that I kind of touched base on is like the why of medicine. Like, why are you doing these things? And really understanding the purpose of what you're doing exactly. Like, why am I volunteering? What does it do for me? What can I pull out from these experiences? Why am I running this research essay? Like, what is the purpose of this like Western blot? And really giving purpose to what you're doing, I think will carry you further in crafting your medical school application. But those are the two big things. Thank you so much for having me. Go Bruins.